Am I on?
Yes.
Okay. All right, so this is Health Nibble number 27. It's about treatment of scoliosis, and actually the best time to treat scoliosis is before a person has grown all the way, and that's like a really critical time because you can see a little curve, and all of a sudden a kid hits puberty and they start growing sideways. So this is a really interesting case. It's the daughter of a good friend of mine, play hockey with him. And he had childhood scoliosis, so this stuff does run in families a bit. And these are actually x-rays of his spine. And so as a kid, he was braced and played hockey, braced and all that. And then he ended up having to have his spine fused. And you wouldn't know it by the way he moves and how active he is, but I'm going to show you some of the treatment that we do. His daughter is actually on traction, so one of the techniques that we do is called chiropractic biophysics, where we actually take x-rays and then we have sophisticated software to analyze the x-rays, and then we have techniques, EAT protocols, which is exercise, adjust, and then traction to correct these curvatures or the abnormal structure in the spine. So there are lots of abnormal structures. You could be like this, sometimes you could be like this, but this is a pretty serious case of scoliosis, and the idea is to avoid surgery for his daughter. So we'll come back and we're going to meet Caitlin. So this is Caitlin, and then there's Colby, her dad.
Hello.
So we just looked at Colby's x-rays. He's the one with the rods in his back, and like I said, you'd never know it. He skates like he's 18. So he's functioned really well, but he still has problems from that. Would you agree?
Yeah.
Yeah, he has lots of, we have problems from that, but we want to avoid that with Caitlin. So let's take a look at Caitlin's x-rays. They're right here. Can you see them?
Yeah.
So pretty big curves in the spine. We felt like that the curves were too big to just work with exercise and traction, so she's actually braced. There are only, my brother is actually the person that we sent, Dr. Heath Nagel at True Wellness Chiropractic, and so Aaron, go ahead and tag him in this, but he's the only one in the whole Fort Wayne area that braces, and unfortunately, the area expert tells people to just watch and wait. There's nothing you can do about it, and then we'll have surgery if you need it. And I'm telling you, there are CBP, chiropractic biophysics doctors all over the world that use these sort of techniques and bracing and save these kids from surgery. So that's the idea. We can't promise that is what's going to happen, but my goodness, put the effort in to try and keep them from having surgery. Would you agree with that?
100%.
Yeah, so Colby, being somebody who's gone through the surgery route, he doesn't want that for his daughter, so we're doing everything we can to stop that from happening. So when you look at her spine, this is Caitlin, and so this traction is the mirror image of her spine. It's real tight. We're actually pulling the spine in a different direction. Now what you didn't see is that we adjusted her in this direction, and then we did exercises over here. This block was specifically set up for Caitlin and her correction, where we have her here, she's strapped in, this Vibe plate is going, and then we have her doing exercises to reverse the curve in her spine. So it's an interesting story. Colby, you can tell the story. You take measurements on the walls, right, of the kids. So Colby, he tracks the kid's height. And what did you find with Caitlin?
Well, yeah, being that I had scoliosis before and the light bulb never went off, but one month I would put a mark up there, and then the next month the mark was shorter. So I'm like thinking, all right, what were you cheating, And so then another month went by, and
thinking like she's stretching out or something, right? Yeah.
So it didn't even dawn until about 2 to 3 months into it that her body's shrinking, and what really is going on is that curve inside is compounding and getting bigger,
going like that.
And her body is just shrinking. So that was we thankfully got in here just the way it worked out. We got in here at a a good time for sure. Yes.
Yeah, and her case is interesting because her shoulders and hips are level, but spine's a little bit like a question, which makes it really hard. Sometimes you can see a kid, if a kid's like this, you know they have a scoliosis, but Caitlin's was a little sneaky that way. So, you know, the point of this is if your kids are under chiropractic care and you have a comprehensive chiropractor, they're going to be able to spot this stuff early on. And then if you have been diagnosed with scoliosis or you have a kid that's diagnosed with scoliosis, watch it. Every doctor makes decisions for their patients. They care about their patients, and they make those decisions with good intent and based on their knowledge that they have available. But there are doctors that tell you to watch and wait. There's nothing you can do. We'll have surgery if it's too bad. We disagree with that. So in here we can evaluate it. My brother Heath, he does the same thing. We're the only ones in the Fort Wayne area that I know of that does chiropractic biophysics, and he actually specializes in bracing, and I know he's the only one from here to South Bend and I think even Detroit. So in a large area that does that. So, you know, and just because of proximity, he would be taking care of Caitlin, but where they live, it doesn't work out. So anyway, if you have scoliosis, there are options. And that's my health nibble.
There you go.
Thanks, man. That was awesome.
How do we shut this off? Oh, finish.